Hi, my name is Nate Lewis, and this is my answers and a couple of my findings from the therapeutic approach debate assignment. So pretty much we have Marcus. Marcus is 28 and he's an African American male um, that is doing software engineering. So pretty much he has been diagnosed with major depressive disorder and as well as generalized anxiety disorder as well. So in addition to him experiencing um, those symptoms, he also reports to have imposter syndrome, and he also does experience a couple of racial microaggressions and also a sense of cultural disconnect when it comes down to his working environment as a civil engineer in a predominantly white workplace. So a couple of empirical evidence supporting um, CBT and also selective syndrome reuptake inhibitors are so like pretty much research also in medication. So a couple of research that like consistently does support the combination of both. So pretty much SSRI S, it pretty much is definitely treatment that does treat both um, major depressive disorders as well as generalized anxiety disorders as well. They work by increasing, so pretty much they work by increasing steroids um, availability to reduce the mood and also to reduce anxiety symptoms as well. And then for cognitive behavioral therapy, so pretty much this is more of like a target-based type of therapy that pretty much targets the patterns of the overgeneralized and also the negative self stigmas that Marcus's might be experiencing currently, and also which patterns like commonly associated with depression, which he does have, and as well as anxiety and the imposter syndrome that he does have. So, pretty much with cognitive behavioral therapy, this pretty much helps clients to reduce, his depression, which Marcus does have, and as well as improve like coping styles to relieve chronic like stress that he might be experiencing, and as well as um, the negative disbeliefs that he might be experiencing as well. Some cultural concerns is definitely the racial microaggressions. But pretty much cognitive behavior therapy does actually address this when it comes down to, especially Marcus is experiencing this in the workplace as well. So definitely, we have to validate his experiences that he is, um, you know, experiencing as well. The imposter syndrome is also another concern. So pretty much the therapy, it should, you know, explain how systematic bias and the lack of self-doubt and rather refraining from his distress of purely individual pathologically, and also like medical medication education. So pretty much given documented mistrust, especially in African American communities, we can possibly, incorporate this in um, for the safety of Marcus and also to promote adherence as well. Um, Expected outcomes when it comes down to participating in CBT and also SSRI. So Marcus will experience his anxiety as well as his depression symptoms to reduce, and also improving in coping skills, and also for managing the microaggressions, especially in the workforce, that can maybe cause stress to him. Um, Definitely healthier self concepts and reducing imposter syndrome by believing more in himself and stuff like that. And definitely increasing emotional resilience, especially in the workplace as well, due to the fact that he's experiencing this. So, in conclusion to all that was said, um, so both CBT and also SSRI medications pretty much will significantly help Marcus's depression and also his anxiety when delivering through culturally um, the lens of his culture. This approach not only addresses symptoms, reducing by the knowledge of the broader social and also racial context in Marcus's mental health, but also it does model and aligns the best practice for treating co-occurring disorders while honoring the lives of African American clients as well, like Marcus.